Your head can pour sweat while the rest of your body stays nearly dry, and that is not just how you are wired. For a lot of people, it points to one of two things: a problem with how blood drains out of the head, or a real vitamin D deficiency that a routine checkup somehow never caught. If you actually deal with those causes, the pillow-soaking scalp sweat at night often calms down. Not because you covered up the symptom, but because you fixed the system that was overheating to begin with. If this kind of straight talk about your body is the type of thing you want more of, take a second to subscribe and tap like. Here on Dr. Waterling, we are aiming for 300,000 subscribers, and you genuinely help push us there. And if you like having simple checklists you can save, scan the QR code on screen to jump into my Telegram channel where I post them. Let's start with what sweating on your head actually means. Your body uses sweat as a cooling system. When your core temperature or your brain temperature climbs, sweat glands release fluid. As it evaporates, it pulls heat away. The skin on your head and face has an outsized say in how your brain reads "I am hot" and how hard you start sweating. In experiments where only the head is warmed or cooled, people start and stop sweating mainly based on head skin temperature and the temperature near the inner ear, even when the rest of the body is kept perfectly stable. So when your head is drenched while the room is cool and the rest of you is fine, your thermoregulation is not just acting random. It usually means one of two things: the head area cannot get rid of heat normally, or your internal control of sweating has been knocked off balance. Now, the first big piece, venous outflow from your skull. Arteries bring blood into the head, veins carry it back out. Venous blood does not just haul away waste, it also moves heat away, the same way coolant fluid moves heat away from a car engine. Inside the bones of your skull, there is a honeycomb layer called the diploe. It is not empty space. It is full of thin, valveless veins called diploic veins that drain into the big venous sinuses around your brain. Some researchers think this network helps cool the brain by letting blood from the scalp and skull bones act as a heat sink. When blood in this system moves well, warm blood leaves, cooler blood arrives, and the temperature of the scalp and the bone underneath stays in a safe range. When the outflow slows down, the cooling fails. Heat builds up in the tissues of the scalp and skull. Your nervous system reads that as local overheating and flips on the backup plan: sweat. That is one of the reasons you can have a soaked scalp in a cool room. The rest of the body feels fine, but the head cannot dump heat efficiently, so the sweat glands up top are running overtime. Why would venous outflow from the head slow down? One reason is mechanical compression of veins along the drainage pathways. The veins that carry blood from the brain and skull bones toward the neck can be squeezed by nearby structures: bone, tight soft tissues, or abnormal veins themselves. In the neck, for example, the internal jugular veins can be narrowed by nearby bones or other tissues pressing on them, which creates a bottleneck for blood trying to leave the head. Now add something that often gets ignored. The bones of your skull in adulthood are joined by sutures. They are not one smooth, fused block. Small shifts after a fall, a head bump, or years of muscular tension can quietly change the shape of those passageways. That idea that tiny shifts in cranial bone position can narrow venous channels is one of the working models behind cranial osteopathic techniques, where clinicians try to restore more normal motion and spacing in those areas. The high-quality research on this specific mechanism is limited, but the anatomy and the broader concept of extrinsic compression of venous outflow are well documented. How would you feel if venous blood is not draining well from your head? You might recognize some of these patterns. You wake up with a puffy face, and it gets better as the day goes on. Morning-only swelling often reflects fluid and venous blood pooling while you lie flat. You may notice bags or bluish circles under your eyes that are worst right after sleep. Those can show up when small veins around the eyes and forehead are under more pressure than they should be. You may also see more visible veins on the scalp than before. Veins that look dilated or, quote, ropey across the sides or top of the head can reflect higher venous pressure in those channels. You may have a heavy, full, or, quote, tight feeling in your head by the end of the day, rather than a sharp pain. That is how many people describe low-grade venous congestion. And on top of all of that, your head and hairline may sweat far more than the rest of you, especially at night or in a warm room, because that is the zone overheating first. There is a pattern from clinical practice that makes this very concrete. In some case series from osteopathic and manual therapy clinics, people with long-standing head sweating plus morning facial swelling and chronic, quote, head pressure reported noticeable improvement in sweating after targeted work on the neck and cranial region. The explanation is simple. Once you ease compression on the venous pathways, blood can leave the head more efficiently, the tissues do not overheat the way they were, and the scalp does not have to cool you with constant sweat. That is not magic, it is plumbing. The scientific evidence is not yet strong enough to call this a proven treatment, but the logic lines up with what we already know about venous drainage and heat control. If you see yourself in this description, what is worth talking through with your doctor? You can describe the pattern clearly. Heavy head sweating, especially at night or in warm but not hot rooms. Morning facial puffiness, dark circles, a sense of fullness or pressure in the head. Ask if anything in your history, old head injuries, significant neck problems, past clots, or major posture changes could be slowing venous outflow. Your doctor may decide that imaging, a vascular consult, or a referral to a neurologist or physical therapist makes sense. It can also be reasonable to ask about a trial of evidence-based physical therapy, or if your physician is comfortable with it, a referral to an osteopathic physician or another qualified manual therapist who works with the cranial and cervical region. The key is that you do this in coordination with a clinician who can rule out serious causes like clots or intracranial pressure problems before anyone starts working on your neck or skull. Now let's switch to the second big reason your head may be sweating far more than the rest of you: low vitamin D. Vitamin D is not just a bone vitamin. It behaves much more like a hormone. It helps regulate calcium and phosphate balance, supports normal immune function, and interacts with many tissues, including the nervous system and skin. In both infants and adults, one of the less obvious signs of low vitamin D can be a very sweaty scalp, especially when overall body temperature does not seem high. With vitamin D deficiency, the pattern of sweating usually looks a little different from pure venous congestion. You may notice that your whole body tends to be more sweaty. Palms and soles that feel damp most of the time, even when you are not anxious or hot, are a classic clue described in clinical and educational materials on vitamin D deficiency. Another typical feature is sweating at the back of the head and the scalp while you are resting or even lying still in a cool room. That points more to an internal thermostat issue than to local heat buildup from blocked veins. Vitamin D deficiency rarely shows up with just one symptom. People often report low mood, more frequent colds, muscle weakness, bone or muscle aches, and poor sleep when their levels are low. Those are non-specific symptoms, but when you stack them together with head sweating and clammy hands and feet, vitamin D becomes a very reasonable suspect. How common is low vitamin D? In large national surveys in the United States, a sizable share of teenagers and adults have vitamin D levels below what many experts consider ideal, especially in winter and in people with darker skin. Studies from northern European regions also find high rates of deficiency and insufficiency in community samples, that is, in people living ordinary lives, not just those who are very sick. The reasons are simple. Your skin makes vitamin D when ultraviolet B light from the sun hits a precursor molecule in the upper layers. If you live at higher latitudes, spend most of your time indoors, cover your skin, or use high-strength sunscreen, your natural production drops. On top of that, research comparing young skin to skin from older adults shows that the capacity of the skin to make vitamin D after ultraviolet exposure can fall by more than half with aging. So the older you are, the harder it is for your skin alone to keep up. How do you actually check your vitamin D status? The test you want to discuss is called serum 25-hydroxy vitamin D. That is the main circulating form and the most reliable marker of your vitamin D stores. It is a simple blood test. You usually do not need to fast, and any standard lab can run it. Different expert groups set slightly different normal ranges. Many major institutions describe levels around 20 to 40 nanograms per milliliter as adequate for most people, while some researchers argue that closer to 30 nanograms per milliliter or higher may be preferable for bone and general health. The key point for you is this: severely low levels are clearly tied to bone problems, muscle weakness, and a range of other issues. And even moderate shortfalls are common enough that checking once is reasonable if your symptoms fit the pattern. If your level comes back low, that is the moment to sit down with a qualified clinician and walk through a correction plan. That might involve vitamin D3 supplements, dietary changes, or supervised sun exposure, depending on your situation. The dose and duration should always be individualized, especially if you have kidney disease, parathyroid problems, or you take certain medications. This is exactly the kind of thing to tailor with your doctor, not to improvise from a bottle on a store shelf. Now, here's the piece most people never get told directly. Both of these mechanisms, venous congestion in the head and vitamin D deficiency, are strongly shaped by age. Research on cerebral venous circulation shows that with aging, venous regulation becomes less flexible and more prone to dysfunction, which can feed into a range of brain and head symptoms. At the same time, that study I mentioned earlier on skin samples found that older adults can have more than a twofold reduction in the skin's ability to generate vitamin D compared to much younger people. In other words, the older you are, the more likely it is that both your coolant system and your sunshine hormone are under strain. That does not mean symptoms are inevitable. It means you have less margin for error and more to gain from paying attention. So what can you do with all of this in practical, non-scary terms? First, start by noticing patterns instead of brushing them off. If your pillow is regularly damp from head sweating, if your forehead feels wet in cool rooms, if your scalp is the sweatiest part of your body, write that down. Note when it happens, always at night, mostly during the day, or both. Also note any morning facial puffiness, dark circles, or head heaviness you feel. Bring that record to your next appointment. It gives your doctor something concrete to work with. Second, bring up vitamin D clearly and directly. You can say something as simple as, I have persistent head sweating and some other symptoms that I have read can go with low vitamin D. Would it make sense to check a 25 hydroxy vitamin D level at least once? That is a reasonable, evidence-based question, especially if you live in a northern climate, have darker skin, are older, or spend most of your time indoors. If your level is low, talk through what correction plan fits you, dose, form, and duration of vitamin D3, and whether you need follow-up blood work so you do not overdo it. Many people find that once their levels are brought into a healthy range, a mix of non-specific symptoms improve. Less fatigue, better mood, fewer infections, and yes, often more stable sweating patterns. It is not a guarantee, but it is a common clinical observation that lines up with the role vitamin D plays in muscles, nerves, and immunity. Third, do not ignore those signs of possible venous congestion. If you notice a combination of head-focused sweating, morning facial swelling, prominent scalp veins, and a feeling of pressure in your head, make sure your doctor hears the full story. Ask whether any structural issues in your neck or head, including old injuries, could be part of the picture, and whether evaluation of your neck veins or cervical spine is appropriate. You can also ask specifically whether a referral to a neurologist, vascular specialist, or osteopathic or physical medicine doctor makes sense to look at venous outflow and mechanical factors. Fourth, zoom out from just sweat and think about your whole risk profile. Head sweating can also show up with thyroid disease, infections, menopausal symptoms, certain medications, and anxiety. A good clinician will want to rule out those possibilities too. The goal is not to lock in on one explanation, but to use this unusual symptom as a doorway into a thorough check of your vascular health, your vitamin D status, and your endocrine system. Age matters for all of this. Research on venous circulation and vitamin D production shows that both systems become more fragile as the decades go by. How old are you? The reason I ask is simple. Your age changes how aggressively you and your doctor may want to look for these causes, and how quickly you might move from let's watch this to let's test and address it. A 65-year-old with a soaked pillow and puffy face deserves a different level of attention than a 25-year-old with the same symptom. When you finish this video, here's a clean next step. Take one sheet of paper. On the left, write down when and how your head sweats, in plain language. On the right, list any of the other clues we talked about. Facial swelling, head pressure, clammy palms and soles, low mood, frequent infections, bone or muscle aches. Then at your next visit, use that page as your script to ask about two things: evaluation of venous outflow from the head and a 25 hydroxy vitamin D test. From there, you and your doctor can decide together which paths are worth taking. Everything I share here is meant to give you a clearer picture of how your body works so you can have a better conversation with your own doctor. It is information, not a shortcut around real medical care. If this helped you connect the dots, stick with the channel, subscribe, hit like, and help push Dr. Waterling closer to that 300,000 subscriber mark. And if you like having concrete tools you can save, scan the QR code on screen to jump into my Telegram channel where I post short checklists and practical health posts.